Welcome back. It's Wednesday and we are keeping an eye on your health, and today we're talking about something that hits really close to home for me. We're talking asthma. I have asthma.
Well, let's teach some people about asthma.
Yes, let's do it.
Because you're pretty informed about it. Unfortunately, a lot of people have asthma and they're not as informed as they could be, and this can kill you. It's a bad disease.
Yes.
So let's look at this. We've brought our co-host here, and when we breathe, imagine it's like an upside down tree. So what happens is the air goes in through our nose or our mouth, and it goes down the trunk of the tree, and then it spreads to the branches in your lungs right here. So as it spreads, it goes to the bronchus, the bronchioles, and the lower levels. And if you look at the inside of the bronchioles, it's almost like the inside of the straw, maybe even the same size. And what happens in asthma is that hole spasms. The muscles on the side spasm when you're hitting a trigger. The trigger is usually some allergen, pollen, dust.
Sports-induced symptoms.
Yeah, some people have exercise, cold, so you should know what your triggers are. And also what happens is you get this mucousy junk on the inside. So this becomes obstructive, and as you know, it feels like you're breathing through this straw. It's hard.
Right, and parents, if you hear your child, that cough that doesn't go away, it's like, you hear the wheeze, that's that mucus.
Yeah, you begin whistling or wheezing because this is so narrow. And you know, this can be a nuisance or it can be fatal. And the thing is, this isn't curable. That's the thing. But that's okay because it's controllable. So what did you do about your asthma?
Well, I've had it since I was very little, and I have a rescue inhaler just like this one, and then I also have some maintenance inhalers. But the big thing is to know when you're in trouble, because as an asthmatic, sometimes you start wheezing and you get used to it, and then you don't know when you're in trouble. And oftentimes when you have an asthma attack, it could be almost too late. Then you find yourself in the emergency room, and Dr. Bose is taking care of you, giving you like 5 breathing treatments, and you know, or
putting
it
a
could
tube
be
in to help you breathe.
Yep. And so there are some really great tools out there to help treat.
Right. So show them what this is.
Okay. So this is a peak flow meter. This is mine. And so what this is you take it and you blow into it, and there's a number here, and your hardest that you can breathe out is you at your best. You're not having any asthma symptoms at all.
So can you demonstrate?
I can demonstrate. Okay, so you're here. Oh, hey, I did
you
good.
pass.
Okay, so I went above. Usually my average is about 350, but I just blew almost just over 400. So that's good. And then you do your worst, and that is when you're having an asthma attack. So if you're anywhere under this red mark, that's when you know you have an asthma attack.
So the problem is most people don't even know their numbers.
No, they don't.
So you should know what your numbers are, and your lungs are aging. So even though you're like, oh, I'm good, the flares aren't that bad, your lungs are aging, and you're going to have 80-year-old lungs, you know, when you're young, and you don't want that. So
No, you don't. And so, I mean, just like what we do at every segment, the best thing to do is go to the doctor, take that allergy test, because that's oftentimes that reveals what your triggers are going to be. And so now you can figure out a treatment plan for that. Very good. Dr. Bose, thank you so much for coming on today.
Prevention's the name of the game here, guys. Go to your doctor, get your preventative meds, and know your numbers.
All right. We're going to take a break. We'll be right back.